you want just comments specific to the session we had?
Let's start there. Yes.
All right. I think that the conformity assessment issue, the foundation of conformity assessment, to me, that I've learned, or maybe I knew it, are the standards that support the conformity assessment, that underlie it. That's the foundation. And so the conformity assessment, the standards that we use, assumes that a certain sophistication of a respirator program. Certain things will happen, certain things will be done. And so everything else is dependent on that. And if those things don't happen, and we've already said they're not happening with non-traditional workers, then we need to either get those non-traditional workers to follow the standards, or we need to find standards that are appropriate for non-traditional workplaces. And some of the, I think towards the last session, what impressed me is the need for knowledge. You know, what is missing in non-traditional workplaces? What makes them non-traditional? And is it a lack of value to respiratory protection? Is respiratory protection not viewed as a valuable entity? When I was a practicing industrial hygienist, I went out of my way to explain that respiratory protection was not safety glasses and it wasn't earplugs, both of which are important, but both of which are fairly unsophisticated devices in terms of training and use. And respiratory protection was always much more sophisticated. And I don't know what's missing, but something needs to be missing. Something needs to be found. And I think that needs to get into standards, or from an OSHA perspective, OSHA has to determine how can they best, and it may even be, you know, public health agencies, state agencies, how can you best help those workplaces which are not, you know, do not have respiratory protection programs that they need. So I'm going to leave it at that.
Thanks. I think that's really good. Luckily, people are taking notes. I'm afraid I have a thought for why that occurs, and it's not just that they don't have a respiratory protection program. They probably don't have a safety program. So it's probably not the only thing they're not doing. But anyway, that's my first unkind thought.